If we are able to have successful prosecution and punishment of the perpetrators, and to have successful prosecution would mean that we should be able to have medical evidence that can confirm, yes, there was a violation, and second, evidence that can link the victim, material found in the victim, to the perpetrator. And to be able to achieve this, you need healthcare personnel who have been properly trained as to how to handle cases of this nature. When you receive a victim, on arrival, ideally you are supposed to take pictures of how the victim looks. If he's looking ruffles, are the gloves torn, are they looking distraught, distressed, all these things at least you should have a picture. And now when the victim comes into the consulting room where they are going to be examined, you are supposed to have a sheet upon which you will change her clothes. So all that the clothes she was wearing at the time of the attack should all be removed and dropped into a sheet that should be sealed and sent for forensic laboratory analysis. Now when the victim is examined, the role of the doctor is to be able to find out whether there have been any injuries. They examine the whole body, including the genitalia, to see if there have been any injuries. Your job, yes, is to treat the victim. But now we need to take certain samples. Like our UNFPA personnel mentioned, you need to take samples from the victim and then the perpetrator for HIV screening, and now screening for HPV. You know, HPV is linked to cervical cancer now. Yes. So screen for HPV. You should screen for hepatitis B, hepatitis C. And then also screen to make sure that the victim is not pregnant now. If pregnancy test is negative, it may need to be repeated later. All these tests that you plan screening for HIV, hepatitis B, hepatitis C, and then HPV may need to be repeated later. Now, if these tests are negative, that victim should have access to what? Preventive treatment. Because was she infected? And if she was infected at the point of examination within 24 hours, that infection will not show. But I don't want to leave the victim to now develop the infection, come back later. So they have prophylactic treatment for the HIV. There's a vaccine for hepatitis B, you give the vaccine. If there's any prophylaxis you give a preventive medication to prevent pregnancy. Don't wait for her to get pregnant with a pregnancy that you don't desire. You see, and when you take all these samples, it's going to the laboratory. They have to be tested. That is cost to the laboratory, but there is cost. You see? And now, these tests have to be repeated some 6 weeks later, some 8 weeks later, to see whether, if the first time she tested negative, will she test positive later? Because if the person is negative and tests positive later, is it possible that that positive test was the result of? So you need all this. Now all those samples that have been taken, some of them may need to go for DNA test. Because if you identify semen, you take a vaginal samples, send it to the lab, they should examine and see whether they are spermatozoa. If they're semen, it may go for DNA test. DNA test is not cheap, it's expensive. And that DNA test, is it the DNA of the perpetrator or the alleged perpetrator? So you should be able to create that link. In the absence of that, you waste so much time in court, but eventually you will not be able to achieve successful prosecution. And these are things that a lot of medical care providers do not know. You may go to the hospital, be examined by a doctor, but they may not go through this rigorous systematic process to ensure that you pick up samples that can link the victim to the perpetrator. So I just wanted to add this because we also need to ensure that every hospital has a reproductive health unit who are properly trained to know how to collect samples for such cases. Thank you very much.